Good evening, everybody. My name is Alexis Chesney. I'm a naturopathic physician, and I'm really glad to be here. Thank you for coming tonight. So as we wait for people to arrive, I'll just start with some background. You may know me as a Lyme specialist. I have been working with patients and clients who have Lyme and tick-borne disease since 2010. And also certainly have branched out since then and have worked with people with many different types of chronic illness like mold toxicity, mast cell activation syndrome. Of course, sometimes we're dealing with layers of different conditions. And I work both with pharmaceutical prescriptions, medications, as well as natural therapies. So that's a little bit of background about me. And I came to learn about Lyme and tick-borne disease through Dr. Richard Horowitz, whom I will always be very grateful for, and started seeing patients in southern Vermont, which at the time I did not know just how much Lyme and tick-borne disease was in the area. And since then, I see a lot of people in New Hampshire and Massachusetts, but also throughout the country and even the world. So you may have come to find me through either my book, Preventing Lyme and Tick-Borne Diseases, or my course, similarly named, or through a summit like the Healing Lyme Summit. So I believe you may have received some videos of what to do after you get a tick bite and acute Lyme and borreliosis treatment. So I'm really excited to see what questions you might have. So we have some time together tonight, and you can certainly add those questions right in the chat. So yeah, I'll just look for those and give you some information so that you have it about myself. So you can find me at dralexischesney.com. If you need to know anything else, I want to make sure you have that. So before I get some questions in, I did have one come in earlier, so we'll get to that. But I wanted to at least give you some nuggets of information with the upcoming fall. Now, we'll see a spike in tick bites come the end of September and October. So it's a great time to remember to do those tick checks and know that those ticks are still out there right now, but we do see a spike coming soon of the adult black-legged ticks. So some of my favorite prevention methods include permethrin. So before I see any new questions as people are arriving, I just want to give you some nuggets of information so that you have that. And maybe you can add something to your regimen to prevent those tick bites. So if you just treat your socks and shoes with permethrin, that will decrease the chances of a tick bite by 73 times. And I love this. I hear back from patients about just how much that helps. And there are many studies on this. So if you use permethrin, when you're applying it to your socks and shoes, and you can also apply it to other materials like clothing or a backpack or a tent if you're camping, please be careful, wear gloves. When it is wet, it is toxic to our skin. But once it is dried in the material, it is no longer toxic to us and it will repel ticks. It lasts 6 weeks if you do that yourself. And if you send the clothing out or materials like a sheet that you might put out for a picnic or something like that to a place called Insect Shield, insectshield.com, they will treat it and then it will last 70 washes. So that's super helpful to think about using a combination of both doing it yourself at home and then also maybe sending out certain items, especially if you're somebody who loves to be outdoors. We're in the summertime. A lot of us are spending more time outside. We're having a little more free time. We want to get out there. We might be hiking or camping. We might be having more family trips, more picnics. Yeah, depending on what you like to do recreationally, please protect yourself against those tick bites. So that permethrin treatment is one take-home message today. If you don't know about that, definitely do it myself. I put it on the calendar every 6 weeks and do my own shoes. I personally use the permethrin-treated insect shield socks because then I know those are my insect shield socks. They look a certain way. And then I have a few outfits that I can use if I'm doing something like gardening or really getting out there and hiking. So I highly recommend that. All right. And then a next nugget of information that I'd like to give to you before we get into questions is tick testing. I think tick testing can be very useful. It's PCR testing technology to identify if and what pathogens a tick is carrying. So if you get a tick bite, you could actually send out your tick to find out if it's carrying any pathogens. This is really helpful because sometimes they are not carrying any pathogens, which is such a relief. But more and more, of course, unfortunately, we are seeing that more ticks have a higher infection rate of certain pathogens, like Lyme, right? So Borrelia burgdorferi or other Borrelia species, depending on where you live, can cause Lyme disease. But there are other pathogens like Anaplasma, Babesia, the list goes on. And it depends on which tick has bitten you regarding which pathogens it might be carrying. So when you send out your tick to get tested, you'll get the identification of the actual tick itself as well as the pathogens in that tick. And that can be so helpful because then you know what action to take, if any. Some people like to watch and wait after a tick bite. I think this is really a personal choice. I know a lot of people who have suffered from Lyme disease or have family members who have. So a lot of people I see, including myself, would want to be really proactive. But I think everyone has a different comfort level and risk tolerance, and that's totally up to you. So some people watch and wait after a tick bite. Some people might get the tick tested to get further information. I like tickreport.com, who is in Massachusetts. They're excellent. So you can check them out, tickreport.com. And they really have a great turnaround time, which is great. So, you might have a few days of waiting, and I think that's tolerable. You can wait as long as you don't have symptoms from the tick yet to see what those results bring. And then if you wanted to, you could start on something like my Deer Tick Bite formula. So if you wanted to get started just because maybe you lost the tick and you didn't save it, or you'd rather just do some prophylaxis, you could use the Deer Tick Bite formula right off the bat for 30 days after a deer tick, or which is also called the black-legged tick bite. Or you could wait to get that tick back. And then once you have it tested, and if you know what pathogens it's carrying, then you can tailor that treatment to it. If you have my book, Preventing Lyme and Other Tick-Borne Diseases, I really outline all of this. There are different formulas that I use based on, a lot of it is based on Stephen Buhner's work, as well as a lot of validating studies that have come out recently, which has been really great over the last several years from Johns Hopkins around certain herbs that are effective against Lyme as well as other tick-borne diseases. So we can also match which pathogen the tick is carrying and do some prophylaxis using herbal medicine based on that. So that's to share some ideas, some top tips today around what to do around tick bite prevention and what to do if you get a tick bite. You can check out my course for more information on my website. It can link you there so that you can learn more if you want to take a deeper dive into these exact topics. So let's get to some questions. So I have one that had come in earlier, and I'm not seeing any others here right now. Let me just see where we are. Yeah, so yeah, the one I had earlier was about testing. It says, there are so many options regarding Lyme testing. It is confusing. Can you help guide me through this process? Now, of course, I am not giving any medical advice here today. That's very important that you know. There are resources out there to talk to a Lyme literate professional. I am one, and I'm happy to see you in an appointment type of situation. You can go to dralexischesney.com for more information about that. If you're interested in finding another practitioner who's Lyme literate, you can go to ilads.org, ILADS.org. I'll put it in the chat as well. This is the professional organization, the medical society that I'm a part of, and I've been trained through. For instance, Dr. Richard Harwich, as well as many other pioneers in this field who've been doing this 30 plus years, are a part of that organization and in educating other practitioners. Yes, so if you want to really get some individualized answers on these types of questions, I will answer the question, hang in there. But if you want to work with somebody one-on-one who can really take a good medical history and individualize these answers to you, then please set up an appointment with somebody. And so there are medical doctors, naturopathic doctors, nurse practitioners, and even supportive folks like nutritionists and physical therapists that are part of this organization who are Lyme literate. So it's a great resource for you, or if you have family or friends. So back to the question. So in general, I can share, what I often share with my patients and clients. So regarding the different Lyme tests out there, it's a lot to think through. So the first one, unfortunately, that's most often given, that if you walked into an urgent care or an emergency room, or you're seeing your primary care doctor, most likely the ELISA antibody test is going to be offered. Now, there is a lot of literature showing that this test is anywhere between 20 and 50% accurate. It is not very accurate, right? So I do not recommend that test. And I think it's really important for you to know that if that test is negative, it does not mean that you don't have Lyme disease. It just means that that test at that level of accuracy happens to be negative. And maybe not, right? We don't know. Maybe it is true that there's no Lyme in your system, but there might be if there's a symptomatic presentation that's making the practitioner think about that. They may want to do a better test, a more accurate test, a more sensitive test. So the next level up is doing a Western blot. Now, you can find some Western blots available through a regular commercial lab. Quest Diagnostics is one of them. So you can actually skip that first ELISA and go right to the Western blot using Quest Diagnostics. So you could even ask a regular conventional primary care type practitioner if they would order through a place like Quest, and then you could get that slightly more accurate test. So it's around 60% or so accurate. So a little better, not amazing, but it's better than that ELISA test. And so if that's possible, that, and often that would be covered by insurance for a lot of people. Again, I can't guarantee that, but in my experience, I do see that that is often covered, and that's very helpful if you do have insurance. So that would be the next sort of step up regarding level of accuracy. After that, we have moving into using specialty labs. So IGeneX is a specialty lab that's been around for a long time now, and thank goodness we have them, because they have worked so hard at providing us with more accurate testing regarding tick-borne diseases. And so their immunoblot for Lyme disease is very similar to that Western blot technology, except it's even more sensitive. And so that sensitivity is about 90%, so much better. The downside is it is usually out of pocket. So the only insurance that covers the Igenex immunoblot for Lyme is Medicare Part B. So not any of the sort of Medicare Advantage, other types of plans that might have that word Medicare in them, but Medicare Part B, the federal red, white, and blue Medicare Part B. So that can be helpful, right, if it's covered. If it's out of pocket at this point of this interview here, it is about $450. So it is an out-of-pocket cost for most people, but that sensitivity is so much higher. It's really helpful to get. Now, let's talk about what do these tests mean. So if you have a positive test come back for any of these, could be the ELISA, the Western blot, or the Igenex immunoblot, any of those positives, because all of these are under the umbrella of antibodies testing, means that you have been exposed to Lyme. So it does not tell us whether or not you have active Lyme disease. So I think that's an important point to understand. Now, clinically speaking, as a practitioner, we're looking at the whole picture. I don't treat people's labs, right? I think about what symptoms you're experiencing, what medical history there is. Was there a tick bite? What is the timing of the onset of symptoms, et cetera, et cetera. And so, of course, looking at the whole picture, weighing all of that information with the lab test result is going to lead us to whether or not we might want to treat. So, even the CDC states that Lyme disease is a clinical diagnosis. So that is the description of a lot of those Lyme tests that are available and that I work with. Now we'll talk about one last test, and then I want to see if there are any other questions. I'm not seeing any questions here. So please feel free to send your question my way through the chat here. And then we'll come back to this conversation. If not, I'm just checking another spot. Hope everybody's doing well tonight. Thank you for joining. I do not see any other questions. Checking one place. All right. So coming to that coming to that fourth option of tests regarding Lyme disease. This is a completely different category of type of testing. So we've talked about those three options regarding antibodies testing. So this next option is not an antibodies test. It is a culture test. It's called the culture enhanced PCR test. And so this is the only test on the market at this point that will be able to tell us if you have current active Lyme disease. So I think that's really obviously helpful. That's usually the question people come to me with. And if we're in those positions where someone can afford that test because it is out of pocket, and if we really are uncertain whether or not there is Lyme there due to a clinical picture, or if we can't, it's not appropriate to do one of the other tests because somebody's already had Lyme and we know they've been exposed already, and we really just want to know, do you have it now? Then we might consider the CEPCR, culture enhanced PCR Lyme culture test. So this test actually is called the borreliosis test because it will test at that genus level. So it will test for Borrelia burgdorferi, which you probably know causes Lyme disease, but there are other species that cause Lyme disease in this country and throughout the world. And there are other Borrelia causing diseases out there, like Borrelia miyamotoi, which is carried by a black-legged tick. It is pretty rare, so thank goodness, but it provides a Lyme-like illness, but it is not considered Lyme disease. It's considered a tick-borne relapsing fever causing agent. So it's nice though, because we can really look at all the Borrelia species throughout the world and test for that through this culture. So that is some information about Lyme testing. And then that culture test will tell us whether or not you have current active Lyme. So sometimes we will do that at the end of treatment. So if we don't do that in the beginning to find that initial diagnosis, sometimes we already know there's Lyme there, and we will treat, and then we will treat 2 months past the resolution of symptoms. I think that's really important to do that. And at that point, usually we're using natural therapies. And then you can wait a month, and after a month of no more antimicrobial treatment, you can then retest, but using that culture test, because then that will tell us whether or not there's current active Lyme there. So yeah, I hope that has been helpful to you on your journey. If you need to know more about Lyme testing, you can certainly access my website, dralexischesney.com, for more information. Also, IGeneX is a very useful website. They have a lot of great information. I'll put that in the chat as well. And they have that culture test as well as that more sensitive immunoblot test for Lyme. And we could certainly spend time talking about other things like the other tests that they offer, like the Babesia fish test and the Bartonella fish test, I think are very, very useful tests that have high sensitivity. And they also tell us if you have current active pathogens. So through IGeneX, you can also find them. Let's see, there is a question coming in. So let's see. Treat past resolution of symptoms. Can you say more about that? Yes. So I always want to make sure we treat long enough, because there is a reproductive cycle of the Lyme bacteria that's monthly. And often when we get to the end of treatment and people's symptoms have resolved, it's a very exciting time, right? People are getting their lives back. They're ready to just move on and not take all of these supplements and treatment. And I totally get that. So it's hard to motivate, to be compelled to continue sometimes, but it's a good problem to have, right? To have made it through most of treatment. And then I always recommend hanging in there, treating 2 months past the resolution of symptoms, to treat past that reproductive cycle. And that's where I really see the best results. So unfortunately, I've had people call, 3 months later, 6 months later, saying, oh no, these joint pains are coming back, or whatever those symptoms were for them are coming back. And we'll go through and say, okay, so how long did you take this treatment? And it so happens that I often find out, well, no, I did maybe 2 more weeks or a month, and not the complete 2 months. So I can't drive home that point enough, because I really don't hear from people if they do that full 2 months, really committed. I know it takes a lot of discipline to do these treatments, but it is worth it in the end to really eradicate the symptoms and stay without symptoms. Yeah. All right. So how about other questions? I'm really curious. I see there are people out there wondering what you're thinking about. Did you watch the videos? Did you have any questions or feedback about that? Do you have any other questions about Lyme and tick-borne disease? We could talk about prevention. We can talk about treatment, testing. We've gone into testing a little bit so far around Lyme itself. We can talk about co-infections. Yeah, whatever's on your mind. So if not, though, we can also wrap up. So don't be shy. Feel free to put something in the chat. And yeah, I don't see any more here. can also share some of the links. So I think you can see them in the YouTube description here. But if you are interested in finding any of the products that I've talked about, you can certainly do that. So Lyme Core is the company that houses my tick preparedness kits. So if you go to lymecore.com, which I'll put in the chat, you can find the tick preparedness kits, which has a little bottle of the deer tick bite formula. So it serves as a little first aid kit in case you have a tick bite. And so you could have the tick kit on hand in the house. And then if you had a tick bite, it prepares you with things like homeopathics that you would take after the tick bite. Ledum I use for tick bites, so you can certainly start on that if you had a tick bite. And then there's also Apis, another homeopathic that you can take if there's any redness or swelling around the bite. Now, it's important to say, if you have any sort of rash or swelling or redness around that bite, super important to report that to a practitioner. That might be an erythema migrans or a Lyme rash. And if that's happening, homeopathics will not be enough. So we definitely want to get proper treatment. I recommend pharmaceutical antibiotics for acute Lyme, as well as other things to complement that and make it a comprehensive strategy. But yes, very important to make sure to get that looked at. So this tick preparedness kit has that, those two homeopathics in case you need them. It has my favorite tool, the OTOM tick twister, to get the tick out, which works very well, so much better than tweezers. And then it also has the little bottle of deer tick bite formula, which you can start 1 teaspoon 3 times a day for 30 days after a tick bite. And it also has andrographis, which kind of going backwards here. Andrographis you'd put on the tick bite after you have the bite in order to help it heal. And also because it is an antimicrobial specific to Lyme, when the tick bites, it can release feces onto the skin. I know this is a terrible image, I apologize. But when it is attached, it can be releasing feces onto the skin, and that can have more pathogens in it. So pathogens, most of the time, we're thinking of transmission through saliva, through the attachment with the mouth parts. But if you take that tick off with that OTOM tick twister, and there has been any feces released, and you're pointing at or scratching that tick bite, you could be bringing in that feces to the bite, which could be also containing pathogens. So andrographis is a great way to kill that. And I do see that they heal up very well after. All right, so I'm not seeing any more questions, so we might be wrapping up here. We're almost at half hour. I'm really glad to see some attendance out there. Hope you're doing well. Hope you stay tick-free. So just give it a little more time to let anyone ask a last-minute question here. Oh, there is a question. Are you seeing any local patients via telemedicine? Yes. Okay, I'm glad I didn't miss that one. So if you go to dralexischesney.com, you can find the scheduling for my private practice. So I see people from all over at the private practice. You can schedule that way, and then you receive electronic intake forms, and then we can do a telemedicine appointment. So my licenses, just so you have this background, my licenses are in Vermont, New Hampshire, and Massachusetts. But I also consult with people outside of those states, and then we just have to understand and use language that does not include diagnosis and treatment outside of those areas. But we can still do a lot with natural therapies, and of course, go through your medical history and talk through recommendations. Yeah, well, thank you for that. And unless I have any other questions, yeah, so thank you for attending. Please subscribe to my YouTube channel. I'm growing the channel, so I would appreciate your support. And I hope that you stay tick-free. Well, thank you so much for joining. Have a wonderful night. Take care.